On this Tuesday night, an SOS from Alberta's ICUs. Fears of a tsunami of COVID-19 patients. They're preparing for the worst.
Choosing between who gets to live and who has to die.
New recommendations about vaccines and who should be vaccinated first, plus a stern message to anyone tired of all the restrictions.
They can storm the beaches of Normandy. We can sit on our couch.
A reality check on Ottawa's promise of fiscal guardrails. What are the limits on pandemic spending? And hopes for the holidays.
This is the first year I will not see my parents over the holidays.
The COVID compromises Canadians are making this season.
Global National with Donna Friesen.
Good evening and thanks for joining us. December is now upon us, and while we all hoped the pandemic would be over by now, the reality is that in many parts of Canada, the COVID-19 crisis is getting worse. In Alberta, where the government was slow to impose even moderate restrictions, case numbers are skyrocketing and the strain on the healthcare system is becoming acute. Hospitals are running out of space and staff. Calgary hospitals have been told to conserve their supplies of oxygen. This is the path Alberta is on. In the span of 1 month, COVID-19 hospitalizations have more than tripled. As of tonight, there are 479 people in hospital with COVID-19, 97 of them in intensive care. Alberta did impose some new restrictions last week, but only modest ones. And because of the incubation period of the virus, it will take time to see if they had any impact. Alberta is nowhere near its peak. Today, the province reported more than 1,300 new infections and 10 more Albertans died. Alberta now has the most active cases of any region in Canada, more than 16,600 active infections. There's fear a tsunami of patients is coming to hospitals where staff are already exhausted, running out of room, and facing life and death decisions. Heather Yourex-West has our top story tonight.
Inside the ICU at Edmonton's Royal Alexandra Hospital, patients are now being treated two to a room, part of a plan to find space for more COVID patients as the infection rate in Alberta continues to grow.
We're also maximizing our occupancy by cohorting patients, by using decommissioned spaces or other spaces that aren't being used at this point in time.
To prepare for the expected surge in patients, a memo sent out last Friday called for the conservation of oxygen at Calgary hospitals. Due to limitation of the bulk oxygen systems at some adult acute care sites in Calgary and the expected increase in demand due to the COVID-19 pandemic, we need to reduce the demand. The health system is working to open another 425 beds in the coming weeks, but even those beds could fill fast. There were 24 COVID patients in ICU on October 30th. That number doubled in 2 weeks, and 2 weeks later, it's doubled again. On Tuesday, Alberta's opposition leaked internal Alberta Health Services modeling that shows ICUs could see as many as 161 patients within 2 weeks' time.
The lengths of stay are not short, so when you have a lot of patients that are knocking on the door to come into the system and the ones that are there aren't ready to leave yet, that's where our challenges arise.
There's nothing that can be done today that is going to stop new admissions for the next 2 weeks. The big question is, how well will the restrictions work going forward?
New restrictions were announced last Tuesday, but not all measures took effect right away. If they work, new infection numbers should start to come down within the next week. But if they don't, there could be a steep price to pay.
If they are wrong, we are in a position where we have to bring in triage and triage tribunals. And that directly means choosing between who gets to live and who has to die.
It's a horrific worst-case scenario that becomes more plausible by the day. Heather Yourex-West, Global News, Calgary.
We know the virus is most lethal in elderly people. Across Canada, the majority of deaths have been people in long-term care. In BC, long-term care homes are again the centres of outbreaks. As Robin Gill explains, that has led to calls for a new approach.
It's never easy to put a family member in a care home. Even harder, keeping them there when a COVID-19 outbreak claims lives. But that's what has happened at the Delta View Centre in a suburb of Vancouver. Leslie Telford trusts the care her mother Sandy is getting there. She just doesn't trust how the virus is being controlled.
Within all of this, we really have to pay attention to their quality of life. That in the will for safety, we can't lock people away indefinitely.
There are 57 outbreaks involving long-term care facilities in British Columbia. The second wave is forcing them to take on desperate measures. Take this seniors' home in Abbotsford, which cares for 700 residents. It's preparing for staff shortages by hiring the residents' family members to clean.
Today we're sitting with 14 positive staff and 12 positive residents. So these things, once they get into a care home, they take a life of their own.
The association overseeing care facilities in BC is led by a former provincial health minister. He's asking that rapid tests be introduced as extra protection.
We have the tests sitting and they're available. There just seems to be some resistance on the part of the provincial health officer and the ministry to go forward with this.
But the province doesn't think they're accurate, and that is frustrating BC's seniors advocate.
Remember that Christmas is coming, and for about a quarter of the people in long-term care, this will be their last Christmas. And we have to think about, should we not be using every tool in the toolbox that we have available to us to add layers of detection and protection?
If anyone should be worried, it's Leslie Telford.
This is the second outbreak, but it has been ongoing now for almost a month.
With no visitors allowed, she is one of many unable to see what's happening inside and the risks facing their loved ones. Robin Gill, Global News, Vancouver.
A remote First Nation in northern Manitoba is asking for military support after an outbreak of COVID-19 there. The situation is unfolding in Shamattawa First Nation. It's about 745 kilometers northeast of Winnipeg. According to Chief Eric Redhead, 69 cases have been confirmed. A rapid response team is reportedly on the ground, but Redhead says his community needs more support. In a letter echoing the call for military aid, MP Nikki Ashton said the acute housing crisis in Shamattawa has meant that COVID-19 has spread much faster than in other communities, and people do not have the ability to self-isolate. She said time is of the essence. We have new details tonight about Canada's plans for vaccine rollout. The Prime Minister says he expects the majority of Canadians to be vaccinated by next September. But long before then, tricky decisions will have to be made about who gets it first. The government is getting advice from an advisory committee, and it is ranked who should get priority when the first vaccine is approved. Abigail Beeman explains.
We had no choice because it was the only way to know how many doses would be necessary.
Dr. Carolyn Quash-Tan chairs Canada's National Advisory Committee on Immunization, or NACI. A month ago, NACI made preliminary recommendations about who should get the vaccine first. The vulnerable topped the list. But it wouldn't say who among that group should go first.
Following that, we heard that the number of doses was even more constrained than expected.
Knowing Canada would only get enough vaccines for 3 million people at first, Quash-Tan tells Global News NACI changed tacks, doing the math on a ranked system to target 3 million Canadians in 4 groups.
People living in long-term care facilities and the staff taking care of them would go first, followed by other elderly Canadians, 80 plus.
If there are enough doses, the committee recommends vaccinating older Canadians down to age 70. Healthcare workers should be vaccinated, prioritizing those on the front lines.
So not those in offices, but really those who are in contact with patients, ideally those taking care of COVID patients. And the fourth group was people from Indigenous communities.
NACI is still waiting on final data about each vaccine, which could change things. Some may be more effective among certain groups. And the recommendations are just that, not binding. Decisions about who to vaccinate first are up to provinces and territories. As for how those doses are divvied up among them, that's a discussion with Ottawa.
There are more conversations to come, and we will keep Canadians informed as we determine what that right order of priority is.
Canada's Chief Medical Officer of Health, Dr. Theresa Tam, said Tuesday after priority groups are vaccinated, targeting everyone else by age would be the easiest and most scientifically sound way to protect the population. Abigail Beeman, Global News, Ottawa.
As we wait for those vaccines, the retired general who is now in charge of Ontario's vaccine task force gave a pep talk to Canadians who are tired of waiting.
And people are tired and say, oh my goodness, we can't carry on. Well, guess what? You can. This is not the first time in our history Canadians have have faced those incredible challenges, they can storm the beaches of Normandy. We can sit on our couch, stay away from everybody else, wear our masks, wash our hands, not touch our face. We can do that for the next months until we get the vaccine working through.
The pandemic has been a huge test of political leadership, and a new poll reveals how Canada's premiers are faring. The Angus Reid Institute survey found Quebec Premier François Legault and BC Premier John Horgan have the highest approval rating, 64%. New Brunswick, Nova Scotia, and Saskatchewan are all next in the low 60s. Approval of Premier Doug Ford in Ontario has slipped since the first wave. 55% of Ontarians approve of his performance now. Lowest in the ranking are the two provinces with the highest number of active cases per capita. Alberta's Jason Kenney at 40% approval and Manitoba's Brian Pallister at 32%. The Prime Minister and senior cabinet ministers are being scrutinized over their handling of the pandemic response too. The federal government is spending more money than ever before to support Canadian individuals and businesses, and that will result in record levels of debt. The opposition accuses the Liberals of spending until the cupboards are bare. Our Ottawa Bureau Chief Mercedes Stevenson is looking at the finance side of things tonight. Mercedes.
Donna, nobody knows how dire the financial situation could become in the second wave of COVID-19, with another wave of insolvencies and job losses expected. Prime Minister Trudeau has been clear, though. His government will continue emergency spending as long as they believe it is needed, followed by a massive fiscal shot in the arm of up to $100 billion in stimulus money. It's unprecedented spending, so to reassure Canadians that this is not a free-for-all, Ottawa has promised guardrails that will determine how much and for how long the government spends, using measures like the employment rate. But there have been no benchmarks on that, and when I asked the Prime Minister today, he wouldn't even give us a ballpark for what kinds of numbers would result in the taps being turned off. While it's not very transparent, some economists say it's likely because the government is operating in tremendous uncertainty.
We have to wait till I think we're a little further along till we really know we're past this crisis before we would expect to see anything very substantive. Get us through this deep, dark hole and then get us prepared to grow as we go through, hopefully, 2021.
Opposition parties won't say if they might bring the government down over the proposed spending, but Mr. Trudeau is not worried about an election.
This is an economic measures that, of course, will be a matter of confidence, but I am reasonably confident that none of the opposition parties wants an election right now. We certainly don't want one.
With only 6 sitting days left on Parliament Hill, any answers will likely wait until 2021. Donna?
Okay, Mercedes Stevenson in Ottawa, thanks. A Canadian actor with a personal revelation. Coming up, the announcement from the star of Juno. In the U.S., a crush of COVID-19 patients is testing the healthcare system. Nearly 100,000 Americans are now hospitalized with the virus, and there are warnings of a surge on top of a surge as people who socialized over Thanksgiving get sick. At some point, hospitals may have to start turning sick people away. Jackson Prosco reports.
With hospitals at capacity, Rhode Island opened 600 beds in a converted convention center as doctors and officials in multiple states warned their healthcare systems are nearing the breaking point.
We're anticipating it. There's not so much a worry of if it's going to come.
There are now more people hospitalized with COVID-19 in the U.S. than at any other time, with multiple hotspots spread across the country and a steady uptick in cases almost everywhere else.
There's only so many resources to go around. And, if the hospital, again, is filled with COVID patients, and strained for resources, you wonder about the quality of care the patients may get.
The issue isn't just a shortage of beds. There aren't enough doctors and nurses to go around. Those on the front lines today have been working nonstop for the past 9 months.
Patient after patient and changing of PPE and worried about your own health and your family's health. And these kind of stresses build up and over time lead to burnout.
As bad as things are, the worry is about what's to come. Millions of Americans defied pleas from health officials and traveled over Thanksgiving, leading to predictions that case numbers will soon surge even higher.
This pandemic is like a high-speed train.
and our projections tell us that we are on target to derail by around the third week of December.
That's around the same time the first doses of a vaccine will likely be released to the public. Far too late to stop what will be the worst days of the pandemic. On Tuesday, the U.S. Centers for Disease Control met to discuss who will get the first doses of an approved vaccine. It's those frontline healthcare workers, the people who've risked their own health and safety and are about to face their biggest test in the coming weeks. Donna?
Jackson Prosco in Washington, thanks. An Oscar-nominated Canadian actor has come out as transgender. Elliot Page now uses the pronouns he, they, and describes himself as transgender. In a heartfelt post on social media, he says, "I feel lucky to be writing this, to be here, to have arrived at this place in my life. I can't begin to express how remarkable it feels to finally love who I am enough to pursue my authentic self." Page shot to fame after starring in the 2007 movie Juno and later the 2010 blockbuster Inception. He has been an outspoken supporter of LGBTQ+ individuals for more than 20 years and spoke directly to them today, saying, "To all trans people who deal with harassment, self-loathing, abuse, and the threat of violence every day, I will do everything I can to change this world for the better." Ahead, the lockdown lifts in England but leads to tears and confusion. A giant leap for another Chinese space probe. It touched down on the moon's surface today. The rover will spend the next couple of days drilling and digging about 2 kilograms of rock and dust that will be sent up to an orbiting vehicle and then transported to the Earth. The last time moon dust and rock was gathered up and sent home was a Soviet mission nearly 45 years ago. Now to England, where a 4-week national lockdown ends tomorrow, but any relief is being tempered by the reality a new 3-tiered system of restrictions will replace it. As Redmond Shannon explains, that's led to confusion and complaints.
We're sick and tired of living in fear. We're sick and tired of being manipulated. And we ain't going to do it no more.
These protests may be the extreme end of England's lockdown frustration, but they are sentiments being felt to some degree across the nation.
This second lockdown has been tough because you're just building up your business again, trying to get back to a normal lifestyle, and then all of a sudden it's sort of taken away.
On Wednesday, England emerges from its 4-week lockdown. A new study indicates that it has worked somewhat. Infections are down 30% and continue to fall, but the sacrifices are far from over.
Huge sections of the country, particularly in the north, will now move to the highest of 3 tiers of regional lockdowns. People are advised not to leave Tier 3 areas, and bars and restaurants there will stay closed. It has stoked the old tensions between England's rich south and less well-off north.
How can the government justify giving Tier 1 areas the same level of business support as Tier 3 areas?
Some MPs in Prime Minister Boris Johnson's Conservative Party publicly demanded to see the evidence behind the tiered approach.
And I know that lots of people think that they are in the wrong tier, and I understand people's frustration.
As England loosens up slightly, neighbouring Wales tightens its rules.
Cases of coronavirus are beginning to rise in the over 60 age group in most parts of Wales.
Starting Friday, pubs and restaurants across Wales will not be allowed to serve alcohol, mirroring measures in parts of Scotland. The Scottish First Minister, Nicola Sturgeon, says healthcare workers there will get an extra $860 thank you payment for their work in 2020. She is up for re-election next year and is pushing for a new independence referendum. Redmond Shannon, Global News, London.
Christmas in limbo. Next, how the pandemic is shaping holiday plans.
You're watching Global National.
It's the first day of December, and there's no doubt we're all in need of something positive and festive to look forward to this year. The reality is that we may not see our friends and family this holiday season. Mike Dorley looks at how Christmas traditions are changing in the time of COVID.
In any other year, you have to fight to get a peek of this downtown Toronto Christmas display. But this is what passes for a crowd in a pandemic lockdown.
holiday awe and wonder?
One. How about that tree?
Meet 2020. So it should come as no surprise that an Ipsos poll found that 9 out of 10 Canadians are modifying or canceling Christmas altogether.
Whether or not they do is another question, but at least at this stage of the game, that's what they're saying their intention is.
Intention? Meet action.
It is just amazing here.
In the form of Toronto's Gibbs family, who traded cold and lockdowns for heat in a virtually COVID-free Barbados.
It's a once-in-a-lifetime opportunity. This was my reasoning. When will I have the opportunity to virtual school my kids from anywhere in the world again? I'm not sure.
Barbados offered long-term visas to Canadians as a way of boosting tourism. Monica and her husband Sam debated the pros and cons and decided they could do 6 months.
But don't you miss all of this? Look.
I miss the snow. I miss the snow.
We have snow today.
We have a tiny, tiny tree.
They also have monkeys visit regularly, who chase them back into the house.
Watch out. Oh my gosh.
Every day is an adventure.
Come inside quick.
But even so, because of work, Sam is only there for the holidays. And while they won't be alone, the bulk of their family will be in Canada.
So I usually host New Year's Eve, and it's 30 people. But my dad's birthday is New Year's Day. And I usually host 30 people every year. This is the first year I will not see my parents over the holidays.
Sun and beach aside, she knows the holidays won't be easy. Adapting to change never is. Mike Drolet, Global News, Toronto.
And that is Global National for this Tuesday. I'm Donna Friesen. There are lots of alternative ways to spread holiday cheer. We leave you tonight with one from Vancouver.
Ho, ho, ho! Merry Christmas!
9 BC transit buses have been decked out with antlers and red noses. They'll be delivering toys and cash donated by transit staff and riders to families in need this holiday season. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.